My name's Joyce Gibb, and I really would like to thank you for being with me today. One of our employee spouses was dealing with ovarian cysts. And so what is that? You know, your ovaries produce the egg doesn't get fully released, and a cyst develops. So what typically is that? That most of the time has to do with what's called PCOS, polycystic ovarian syndrome. And that starts with insulin resistance or a bad diet. And then that insulin resistance raises insulin, of course. Your blood sugars go up, your insulin goes up. That promotes ovarian dysfunction, which is specifically just having cysts on your ovaries. And they're very, very painful. I know when I worked in the ER, I mean, that is, and women get these frequently. So what happens after that, your eggs are being produced, but then they develop cysts on them. Then they rupture and their pain goes away. But that typically leads to ovarian dysfunction, and that can be low progesterone. Okay? Low progesterone, you can either have high estrogen or low estrogen with that whole picture, and then testosterone rises. So this is a whole polycystic ovarian picture, and it's usually depletion of zinc. That's another thing. A poor diet, like you see some of these women, they can gain 100 pounds, and this is no exaggeration, over a year's period of time. And they grow hair, mustaches on their face, the hair on their scalp thins, and it's all because of something called high androsterone, which is 3 times, it's a metabolite of testosterone, and it's 3 times more potent than testosterone itself. So what does it do? It all starts with a good diet, helps reduce the risk of having, ovarian cysts. So I also like to help you with that. We need to talk. There's many women that this happens to, and PMDD, which is premenstrual dysmorphic disorder, kind of goes with that whole picture on some women too. And there's varying degrees of within each diagnosis. So polycystic ovarian syndrome with low progesterone, women feel like they want to kill themselves. Literally, they are irritable. They get mad at their husbands or their boyfriends for any little thing. They yell at their kids. They're anxious, they're moody, they're depressed. So that's something that we can help. And it's one of my favorite things to treat because within a month or two, the patient has a new life. Typically, what I like to do is do a Dutch test. So you measure your hormones when they're at their highest if someone's still cycling, and that's days 19 to 22. Day 1's the first day of your cycle. This is if you're having 28-day cycles. So I try to get the hormones at their peak. And so we get a better idea really what your hormones are doing. But some supplementation that people can take from that, in addition to changing their diet, is many times we add topical bioidentical progesterone over the counter, because that produces more calm, won't make you as irritable, will help you sleep better. The other things sometimes we use is called I3C Complete, which has 3 ingredients in it, and that helps clear that estrogen just a little bit, depending on how high the hormone at the 3 estrogens are as to what amount I use. This is just clinically over time. I feel like it's one of my favorite things to treat because people get better, and they've been like this their whole life. They'll get better in a couple months. But I3C Complete has indole-3-carbinol, which is the concentrated ingredient in cruciferous vegetables, has DIM, diindolylmethane, and calcium D-glucarate. Both of those actually help clear estrogen through the liver. Phase 1 detoxification happens in the liver. That's how you clear your estrogens. And so depending on how high the estrogens are as to how much I use. But I'd love to help you. There is hope. I want to give you hope. And set up an appointment to come see me. Thanks for watching. If this information was helpful, hit that thumbs up button down below. If you want more videos like this, hit the subscribe button down below, then ring the bell next to it. Also, if you know other people that you would want to share this link with, please do so, because I would love to help them on their journey to good health.